Welcome. My name is Moira Cook, and I am District Director for the Health Department here in Addison County. I am also a member of the Addison County Committee on Substance Use and Prevention. We're focused on preventing drug use, and we're focused on promoting treatment resources and recovery resources. Today I'm really pleased to be here with Jessie Brooks. Jessie is the Regional Prevention Partnership Coordinator and the H.E.L.P program co-creator. She works for the United Way of Addison County here in Middlebury. Welcome, Jessie.
Hi, thanks for having me.
So, Jessie, before we start talking about your prevention work, I'd really love to hear a little bit about the United Way and what it is that the United Way does here in Addison County.
Yeah, absolutely. So, United Way of Addison County really focuses on creating a community where everybody has what they need to be successful. Mm-hmm. And in order to do that, we focus on three main areas: health, education, and financial stability. And we, right now, our donors are funding about 27 nonprofits locally, as well as nearly 40 programs in Addison County.
That's great. That's great to hear. So tell me a little bit about some of the programs and how they may relate to some prevention efforts.
Yeah, right now, due to some emerging needs that we have here in Addison County, that's where our focus is. One of the programs that we offer is a program called United at Work, which targets at-risk workers. And we have a resource coordinator who goes into some of the employers locally and works with at-risk workers and gives them support and resources in order to be successful and maintain their job, essentially. The other thing that we've been focusing on is the Mentoring Collaborative. We have been mapping out a program that's designed to target disengaged youth. So youth who are not at work, not in school, and where they are and what are they doing.
Yeah.
And we're kind of in the infancy of that program, but it's really designed to support that pretty large population of kids who are out there in Addison County. And the last one really is H.E.L.P. It's a program that I co-created, and it stands for Heroin Epidemic Learning Program. And it's a youth empowerment program designed to educate youth on the opiate and heroin crisis.
That's great. We'll get into the H.E.L.P program in just a little bit, but I'd love to talk to you about the Regional Prevention Partnership Grant. Can you tell us about that grant, how long you've had it, how much the funding is for, and any details you'd like to share?
Yeah, absolutely. So the Regional Prevention Partnership Grant, it's a 5-year grant through us. We're about 2.5 years into it. The Regional Prevention Partnership Grant is a grant that's designed to reduce the use of substance abuse between the ages of 12 and 25. And it targets some main categories such as binge drinking, underage drinking, marijuana use, and prescription drug misuse. And right now the funding is about $130,000 a year.
So it's a significant amount of funding to really make a difference in the community.
Absolutely, yeah.
So tell me some of the things that you're doing with that grant.
Yeah, so far we've been really successful with what's called Dept, which is a drug impairment training for educational professionals. It's a training that provides information and support to education staff to be able to identify signs, symptoms, and behaviors of drug impairment.
Oh, wow.
And especially in this climate, I think that's necessary. And we've hosted 2 of those successfully this past year. The other thing that we've been working on is mindfulness. So we have been working with the Virgins Union High School and training a pretty large number of their staff on mindfulness, being able to implement it in their school, not just occasionally, but really as part of their curriculum and culture at their school.
Great.
So in hopes that it supports students in the way that it needs to, and it supports staff in implementing it.
So for both of these programs, it's really school and school personnel driven, or targeting those folks, or?
Yeah, I think schools for the most part are an easy resource, especially for this grant, because it's the ages of 12 and 25. Mm-hmm. So it covers a wide range of that demographic for us. We work with law enforcement as well. We partner with them on supporting them through sobriety checks, providing resources during those checkpoints to people that they meet. They also pull over, and they provide them with resources, treatment, and prevention. As well as we work with law enforcement and actually go into high schools as well and do impairment trainings with students and staff.
That's great.
Yeah.
So I also understand that this program has helped to bring drop boxes and promote prescription take back. You want to talk a little bit about that?
Yeah, that's a huge piece of the grant. So we do what's called Take Back Day, and we help promote Take Back Day, which is a day that's really to build awareness about safe disposal of drugs that are unwanted or unused. So instead of flushing them down your toilet or just having them in your house, which we all know is not a very safe thing these days, it really builds awareness on where you can properly dispose and how you can properly dispose. We have permanent drop boxes located around Addison County as well as the state, and on that day, that Take Back event day, you'll see some temporary drop boxes pop up as well, and it's an opportunity for anybody to dispose of unwanted or unused medications.
So on Take Back Day, you can go to a bunch of different locations to drop off your prescription drugs that you no longer need, and then there are permanent drop boxes. Is there a fee? How do people do that?
It's free. It's anonymous. You can walk in, you unscrew the lid on your prescription bottle, you pour in your unwanted, unused pills, and you walk out. It's really simple. At some locations, you can get additional resources if you want them for treatment and prevention. A lot of the Vermont State Police are going to be starting to offer permanent drop-off locations. A lot of pharmacies have these as well. So it's just a really good opportunity to get rid of that and not have it around your house.
That's great.
Yeah.
That's great. So it just cuts down on potentially crime and other unwanted behaviors in your household.
Yeah, absolutely. I also think from an environmental perspective too, where we have these being flushed down the toilet, how it affects our water, and just disposing of around our parks and other community areas. I think it's from a safety perspective as well as an environmental perspective, it's definitely something we should be focusing on and building more awareness around.
Is there anything else about the Regional Prevention Partnership Grant you think would be important for folks to hear about?
Not that I can think of off the top of my head, but
that's fine. I mean, it sounds like it's a great program. I know you've also done some marketing around just prevention messages. I'm familiar with the health department's Parent Up campaign, and so that's a good educational resource for parents about having conversations with your kids around substance use. So it's really, there's a lot of resources we've woven into this grant, and it sounds like you're bringing great partners together through law enforcement and school and community groups. So I'm really thrilled to hear about this. Tell us about the H.E.L.P program, and you mentioned that it's a heroin education project. Can you just talk about where you've done that project and who's involved and what's the goal of that work?
Yeah, so I'll back up a little bit and explain how it happened. H.E.L.P was created really last year. So this is the second year of launching H.E.L.P, but H.E.L.P was created because a gentleman by the name of Jeremy Holm, who is a TV and film actor who also lives here in Addison County, lost his friend to a heroin overdose. And he wanted to do something, and he came up with this idea of what initially started as a poster contest. We met one day, and with his film expertise, we decided that we would make it a public service announcement project.
Oh, great.
And while talking about it, we also realized that we were not experts and that we had to bring in area partners to support us and support the students. So it's a youth program that we bring into high schools. We work with law enforcement, we work with an area medical examiner who's also an EMT. We have a woman who's in recovery she's been in recovery for about 4 years. She's a single mom. And she shares her story. I share my story because I grew up with a parent who battled an opiate addiction. And then we support the students on the film side of things because we are tasking them with making public service announcements. And though most of them are more tech savvy than I was at their age, we want to support them to be successful to create the public service announcements. So we have Jeremy, who's a H.E.L.P director, and he's a TV and film actor. He runs a storyboard writing class.
Great.
Yeah, and then we also have a professional film editor who works with the students, and he actually also edits the final PSA. We run a contest. We have a winning PSA. He edits that one so it's ready to air on local and national television.
That's incredible. That's an amazing homegrown project with a really incredible resources and talent right here in our backyard. So tell me, who's done this program? Who's been involved in terms of the kids? It sounds like the experts in the room have been incredible.
Yeah. So last year, we were in our region of Addison County. So we were in Mount Abraham, which is in Bristol, Vergennes High School, as well as Middlebury High School. And last year we had nearly 40 students participate in the program. We had a total of 10 PSAs completed and submitted through the program. And last year we had 15 volunteers participate as well and volunteer their time. This year we are back at Mount Abraham, we are back at Vergennes, and we are at Hannaford Career Center.
Oh, great.
Yeah, so we've also branched out to Randolph High School, and we've been talking with some other high schools in the state, CVU, as well as high schools up in the Northeast Kingdom. So
wow.
Yeah.
So it's really spreading quite well.
Yeah, and we have over 50 students participating currently in the program. So
that's great. And so is there a way for people to see the PSAs that were created last year?
Yeah, so we have them through the United Way. We share them with the schools for the students that participated. And I guess if you participate, you can see them and create your own.
So go to the United Way website to see this great work. And you did pick a winning PSA or no last year?
Yeah, we did. So we have what's called the H.E.L.P committee, and it's a panel of people who watch all the PSAs by themselves, and they score, they pick their top 3, essentially. And the winner last year was an overwhelmingly obvious win, and they were a group from Mount Abraham High School. We actually they were a group of 2 ninth graders and 1 senior.
Oh, that's great.
Yeah.
That's great. So then you've also gotten a grant called the Cures Grant, and this Cures Grant helps to fund the H.E.L.P program, and will also help a community book read. Can you tell us a little bit about those 2 things?
Yeah, absolutely. So the book read is on the book called The Seventh Wish, which is a book written by a local author by the name of Kate Messner. And the book is about a girl who goes fishing on Lake Champlain. She catches a fish, and in exchange for the fish's life, the fish offers the girl a wish. And there's a series of things that happen in the book, but without giving too much away, it turns out that the little girl's sister ends up having an opiate addiction. Oh, okay. And it's just a great story and format to introduce opiates to a younger audience, I think. And so what we're doing is there's been some smaller book reads with this book around Addison County already, and we're essentially enhancing this and trying to reach a much larger audience all at once. So right now we're in Addison Northeast County district, working with elementary schools and the middle school at Mount Abraham, getting this book read by students, working with parents and librarians, providing them with books, and we're also and resources to help with those conversations.
Great.
As well as hosting an event with the author in Bristol in March. So
that's going to be great. And how many people do you think will be coming to that event? Is that a big event or?
Yeah, I'd say it's a pretty big event right now, considering we haven't been promoting it too long. We have a little over 100 people.
Oh, wow.
And most of those are student numbers that you're hearing. So I think it's a pretty successful read so far, and we've had a lot of local community efforts from a particular volunteer who's been helping us really promote this and get this enhanced throughout the district. So we've been fortunate.
That's great. So this other funding covers the cost of the books and. Yes.
So
that's cool. So then there'll end up being a lot of copies of this book in the libraries, and for more people to be able to read and have conversations with.
Yeah, the idea is to really, share. It's once these books are purchased and this district has read them and been saturated with the conversation and the content, the idea is to branch out and share with other districts in our area and share the books and the conversation and build awareness around this.
And so what's the age group for this book, The Seventh Wish?
I would say the age group is really 5th graders through 8th graders.
Okay, great.
And I think it's a great book for parents too. It's an easy read for parents, and it's just a great way to have a conversation with your kids about a difficult topic.
Yeah, so it's really, the book's a great book. It's a local author, a local story, but you're really trying to promote the conversation between parents and kids and families and kids.
Yeah, I think we all know how influential parents are and can be, and especially with their own kids. And if they're talking about it, that's a huge piece of prevention. So
that's great. That's great. So tell us a little bit about how you ended up in this work, given that it seems like you're new to this field. The grant's only been around for 2.5 years. So how'd you end up at the United Way?
So I was at the United Way running their volunteer center part-time. Yeah, so I was getting volunteers for the local nonprofits that we fund, as well as just the organizations that are out there that we don't fund. Just working and networking in the community, and that was just a part-time job. We received the grant, and I was offered that opportunity to work there. So
tell us a little bit more about, you mentioned doing some presentations with law enforcement. Tell us a little bit about some of the work you've done with them. I assume that it sounds like they're involved in the H.E.L.P program, but you've also done some training, some other programs with law enforcement?
Yeah, so we go into high schools and we do impairment presentation. That's also funded by a grant that the Vermont State Police have, known as the Highway Safety Grant. Mm-hmm. So that presentation covers impairment of marijuana, impairment of alcohol, and impairment of opioids. And we also cover distracted driving in that presentation, and it's a little bit more in depth, more raw content of all those things, especially delivered by law enforcement. But it's a great way for students in law enforcement to start to create a relationship, get comfortable with each other, and a good opportunity for students to ask them questions that they wouldn't otherwise have. So.
Right. So what kind of questions do kids ask? It's just probably really interesting for people to know what's going through the mind of a teenager in front of a police officer.
Yeah, well, the most recent one that I was involved with was what is it like to handcuff somebody?
Oh.
And I was handcuffed as the guinea pig. That was the first time I was handcuffed, admittedly. So that's one of them. I think the other thing that kids are asking on a more serious note is like, how else can they use the state police as a resource? That's what they want to know. I think a lot of kids think of law enforcement as arresting people, and they don't consider them a prevention resource or a way to get information about, let's say, if they get a prescription that they're not comfortable talking with their doctor about, they can go home and actually call the state police and say, I've just gotten this. I don't know exactly what it is, if it's an opiate, if I can become addicted to it, that sort of thing. So
that's really great to hear that the state police are being involved and are getting involved and are really acting as a resource. And it's just nice to think about different types of partnerships that are being created to, in somewhat of a mentoring and education role for young people in our community. You mentioned mindfulness earlier, and I think it's really important to just talk a little bit about that initiative again. It's great that Friends Union High School has really taken that on as a piece of their work and actually bringing it into the curriculum. Can you talk a little bit about the connection between prevention of substance use and mindfulness and what that work is trying to do?
Yeah, so mindfulness is just a way that we can just be more aware, as well as more aware of ourselves as individuals, more aware of our surroundings, who we are, and what our impact is on our community, whether that's our school community or our community as the Addison County community, or even in a family setting. And they're doing little activities such as just taking maybe 30 seconds to breathe. That's 30 right. seconds to be quiet, things like that. When we live in a day and age where there's constant chaos and there's constant distractions through devices and media, I think this is a really great initiative to slow things down a bit. And what that does is when kids are extremely stressed and overwhelmed, it brings them back down to a normal level. And when they're going from class to class to class, and then they have sports and all these other extracurricular activities, and maybe life at home isn't perfect, they're being given tools to be able to calm themselves down in moments where they otherwise might not be able to. And I think building it into their curriculum and their atmosphere as a school, where it's not done sporadically, it's done every day, it's done multiple times a day, so they're getting that consistency that they need to learn these tools and then implement them on their own eventually.
That sounds fantastic. It just gives people the skills they need to know to say, and these are lifelong skills, it sounds like, it's one thing if you feel like you're struggling with a class and you can just take a minute to breathe and calm yourself down. Then you go out into the hallway, you have an argument with, another kid in school, but then it'll translate to when you're in the workforce and can take a minute before a big presentation or whatever. So that's just incredible. And I'm sure it helps them at the school with some behavioral issues. If everyone's just taking a second to step back and breathe, that makes a huge difference in the entire culture. So it's great to see that initiative is going forward. And so I don't want to lose any of the thoughts here. You've got a lot of work going on here, Jessie, between Regional Prevention Partnership, the H.E.L.P program. Is the H.E.L.P program currently going right now, or are you about to start it for the spring?
Nope, it's currently going in all 4 high schools right now. So we're at Randolph, we are at Hannaford, we're at Bristol, Mount Abraham, and we're at Vermont. We're wrapping up the 3 Addison County ones, and we're right in the middle of Randolph. So.
Oh, that's great.
Yeah.
So that's part of the high school curricula as well.
Yeah, so most of them have built us into a health class, or sometimes it's on the film side of things. Sometimes it's like a digital storyboard writing class. We're not picky. We'll let you fit us in wherever we can. But health classes seem to be the most ideal spot for us to be worked into.
Oh, that's great to hear. So you've got that going, and then those students will produce their amazing PSAs, and then they'll be in another award or not. I don't know if you're going to choose winners again this time.
We are choosing winners here in Addison County. Our winning team each will win Chromebooks.
Oh, so, there are prizes.
There are prizes. So yeah, this is a serious contest.
Wow,
so,
that's cool.
Yeah, so we like to. I think there should be an incentive after all that work. It's a lot of education and it's a lot of commitment, and I think students should reap the benefits of that and feel the success of the program.
That's great.
Yeah.
And then the 7th Wish, do the libraries have the books? Are they starting to promote that? How is that being kicked off?
Yeah, for the most part, everybody has the books that they need to be sharing with students and parents. We are promoting it. It's March 26th. At Holly Hall in Bristol, starting at 1 p.m. So, and it's open to the community.
Oh, that's great.
Yeah.
And in between that, you're helping out the United Way and all their amazing work too, in terms of supporting the community and making sure that the community needs are being met. We only have a couple minutes left. Are there any final thoughts that you have about all these prevention activities that you're doing? It's just been really great to hear more about all this work.
No, I think the one thing that I would say is that it's a collaborative effort, and I think that that's one thing that United Way definitely pushes is collaboration and partnership, and all of our efforts are not done by just one person. Just like the H.E.L.P program, we bring in all partners from the community, and that's the way that we can be the most successful, and that's why we've been so successful in many of our initiatives. So it's the community in general that we work in, and we're lucky to be here.
That's great. Great. Thank you so much, Jessie, for your time today. I just really appreciate all the work you've done around prevention and really promoting these great initiatives. You talked about a lot of fantastic work that you're doing, so it's really just exciting to hear about them. And if you want more information about the Regional Prevention Partnership and the H.E.L.P program, you should go to the United Way's website, and you might be able to see those great PSAs. And if you're really, if you're interested in hearing more about the Addison County Committee on Substance Use and Prevention, the website is addictionhelpvt.com, and it'll be on our screen at the end of this program. Thanks again, Jessie, for all your time.
Thank you for having me.
My pleasure.